Okay, so our topic for today is travel medicine. These are the lecture objectives of travel medicine. So basically, what is travel medicine? Travel medicine is what international travelers seek the well-being and their overall health management before they go on to travel to different countries. So international travel has increased in the recent decades due to advancement of technology. Likewise, there has been transmission of diseases from one place to another. So talking about travel medicine, first of all, I would like to discuss pre-travel assessment. So travelers seek pre-travel health advice about 35 to 60% of the time. Only 10 to 20% visit the designated health clinic, and 8 to 20% seek medical care post-travel. And then there are VFR travelers. What are VFR travelers? VFR travelers are visiting friends and relatives travelers who are born in let's say, in a third world country like Pakistan or Nigeria, and then they immigrate to another country like US, and they live there for a good part of their life. And when they travel to to the country in which they are born, they are less likely to follow certain regulatory and safety measures uh, for themselves. And because they have lived in a developed country for so long, so their immunity has changed from what they had in their country of birth. So this is the CDC Yellow Book. CDC is the Center for Disease Control. This is an American journal and an American website which provides information on different type of diseases that are present in different countries. For example, yellow fever is present in South America and certain African countries. Then dengue is endemic in Pakistan, India, and certain countries. And then there are diseases that are specific to certain countries. So this CDC Yellow Book provides information to travelers that if they are going to a specific region, what type of measures they should adopt for prevention against that disease, what type of vaccination they should get as a prophylaxis for avoiding diseases. So this is an immunization list of different vaccines and their schedules. So commonly, you can see there are different type of vaccines. So there are some type of vaccines that are recommended for international travel, which includes yellow fever, typhoid, meningococcal, hepatitis A, etc. Okay, so first, the first disease that we would like to study is polio. Polio is a disabling and life-threatening disease caused by polio virus, and it spreads via blood to central nervous system. And the polio virus causes destruction of cells in anterior horn of spinal cord, which results in lower motor neuron lesion. And this results in hyporeflexia, hypotonia, and fasciculation. So you can uh, see all the symptoms which are commonly found in lower motor neuron lesion. And if it involves diaphragm, then it can result in respiratory failure. So the vaccine for polio are of two types. One is injectable polio vaccine or IPV, and the other is oral polio vaccine or OPV. So OPV and injectable both are included in the schedule that is provided from birth to 15 months of age. And then there are booster vaccines which are provided to children under 5 years of age. And because polio is still endemic in our region, so the people who are going for Hajj or are immigrating, they require polio vaccine booster. And another difference between oral polio vaccine and activated polio vaccine is that the oral polio vaccine contains the live virus, and the inactivated vaccine, as the name indicates, it contains the inactivated vaccine. So there is a relative risk of getting the disease if someone is immunocompromised. So these are the countries in which polio has still not been eradicated, and from which most of the countries that require polio vaccine. Then hepatitis A. Hepatitis A, as the name indicates, it is an infection of liver. It is transmitted by fecal oral route, and there is short incubation period of about 4 weeks. There is no career state like hepatitis B or hepatitis C. It is generally self-limiting and does not require a specific treatment or admission. And the symptoms include jaundice, abdominal pain, and vomiting. A few of the cases, however, develop fulminant or liver failure. Then this is the map which shows the hepatitis A prevalence. This mostly indicates that it is prevalent in developing world. Then about the epidemiology of hepatitis A, this is the second most common vaccine preventable illness acquired in travelers. The risk is 3 per 1,000. And there are certain groups who are more exposed, for example, Peace Corps volunteers. Then about the vaccine, there are 2 doses of vaccine which are given 6 months apart. It has 94 to 100% protective immunity after first dose, universal vaccination for infants. For travelers who are going to the regions where this is common, it is recommended that they get this vaccine shot 2 to 4 weeks prior to travel. Then the second disease is meningococcal meningitis. This is caused by bacteria, which is called as Neisseria meningitis. It is transmitted by respiratory oral secretion, aerosol air droplets. The classic triad includes fever, headache, neck stiffness, and this is a bacterial meningitis. It can be diagnosed by PCR or cell culture. It can be fatal in 5 to 10% of cases, even with antibiotic treatment. The treatment includes cephalosporin and penicillin. Then this is the meningitis belt, where this disease is very common. This is the these are the sub-Saharan countries, and there's this specific time period during which it is more commonly seen to get transmitted. Then the vaccine is this is the only other vaccine aside from yellow fever which is required for border entry during Hajj. Then the vaccine is a conjugated vaccine and it is approved for use in age group 2 to 55 years, and the booster is recommended every 5 years. Then we have a disease called Japanese encephalitis. It is transmitted by a mosquito, that is Culex mosquito. It is a viral disease. Less than 5% of cases are symptomatic. That means that most of the times the disease remains asymptomatic. Then there are certain habitats in which the disease gets transmitted, which includes rice fields. And there are certain secondary hosts, pigs, for example. This is endemic to much of Asia. The vaccine is Japanese encephalitis vaccine, which is recommended for adults greater than 17 years of age. The schedule includes vaccination on day 0 and day 28. So, because less than 5% of cases are symptomatic, so it is not recommended. This vaccine is not recommended for all. It is recommended for certain people, for example, who have a long stay or for short-term stay, there is a high risk, for example, in rural areas, outdoor exposure, and if there is a Japanese encephalitis outbreak going on. Then there is another disease which is very important, which is called as rabies. So rabies is also a viral disease. It is transmitted through bite of a rabid animal, which can be dog, bat, raccoon, skunk. So it is transmitted through direct contact, such as through broken skin with saliva from infected animal bite. Results in cytoplasmic inclusion in brain, and the symptoms of this disease are photophobia, hydrophobia, hypersalivation, muscle spasms, trauma, and death. So it progresses in this way, and this disease is 100% fatal if it is symptomatic, and if a previously immunized person does not get the vaccine within 24 hours. So prior to rabies virus exposure, 3 doses are recommended on 0, 7, or 25, 21, or 28 days. Then, who should get rabies vaccine? Travelers with high risk exposures, prolonged rural animal exposure, vets, lab workers, animal control, wildlife workers. Then there are vaccine risks, for example, headache, muscle pain, and hypersensitivity reactions. Then, if someone who gets bitten by a rabid animal, such as dog, what should be done? The wound should be cleaned thoroughly. Plus, if the person is previously immunized, the vaccine should be provided along with immunoglobulins, which is called as active and passive immunity. And if the person is previously vaccinated, he or she requires 2 doses of vaccine, and if the person is unvaccinated, he or she requires 4 to 5 doses of vaccine. Then yellow fever. It is an acute viral disease caused by yellow fever virus spread by a wild mosquito Aedes aegypti. So this mosquito, other than transmitting yellow fever, also transmits dengue, chikungunya, Zika virus as well. So this is endemic in tropical areas of Africa and Central America. Symptoms of the yellow fever include fever, headache, jaundice, bleeding, muscle pain, back pain, hepatomegaly, red eyes. So this is the distribution of yellow fever. You can see it is common in South America and African region. Okay, so this is the only vaccine potentially widely required for border crossing if the person is from the region where yellow fever virus is endemic, and the live virus vaccination is recommended after every 10 years, and it should be given at least 10 days prior to departure. So this is the vaccination card which is provided once the person gets vaccinated. So there are certain contraindications if the person is immunocompromised, if the person has thymus disease, which is responsible for T cell maturity, if the age of the person is less than 9 months, and then special precautions should be taken and pros and cons should be evaluated for person who is greater than 60 years old and during pregnancy and lactation. Then enteric fever. This is a multisystemic illness caused by Salmonella typhi and Salmonella paratyphi. These are bacteria, and these are transmitted through fecal oral transmission. So this is the epidemiology. There are certain regions where the disease is more commonly found. You can see Pakistan, India, and Afghanistan, Bangladesh. Most of the developing countries are in the list, and in the African region as well. So the clinically it presents as the incubation period is 7 to 14 days. It presents as roll spots in abdomen, which are seen in abdomen, non-specific febrile illness, which includes chills and malaise. Then there is abdominal discomfort, abdominal pain, and then there is constipation initially, which is followed by diarrhea. Okay, so the disease colonized gallbladder and may result in carrier state where the person may experience resolution of symptoms, but he or she may, without knowing, pass the bacteria in urine and stools and potentially infect other people. The complications of enteric fever include bleeding, intestinal perforation, and encephalopathy. So for the vaccine, we have oral live attenuated vaccine and capsular parasaccharides, which is injectable. So the oral vaccine should be given at least 2 weeks before travel, and 4 doses are given over 8 days. And revaccination is required every 5 years. The injectable vaccine offers protection for 2 years, and it can be given to 2 years and older, but it is not protective against paratypes. Then traveler's diarrhea. Traveler's diarrhea is the most common illness in travelers caused by drinking water or eating food such as bacteria, virus, and parasites. It usually occurs within 10 days of travel to poor public hygiene. It is mostly caused by bacteria, E. coli. Then it can be also be caused by viral hepatitis A or hepatitis A, hepatitis E, and then can be caused by parasitic as well. This is the region where the disease is most commonly seen in tourists and travelers. It can be prevented by bismuth, and it is the recommended treatment for traveler's diarrhea because of the widespread antibiotic resistance which has been seen in the decades due to misuse of antibiotics. So the antibiotic is recommended as ciprofloxacin. So who should take antibiotic as a prophylaxis? Travelers who are going to another country for important business meetings, for them who remaining well during trips remain critical, or someone who is immunocompromised, or someone who has irritable bowel disease, chronic diarrhea, someone who has colostomy, who are already experiencing food loss, someone who's in diuretic therapy. So these conditions are already if the person in this condition are already experiencing food loss, so they cannot afford to lose food due to traveler's diarrhea. Then the antibiotics include ciprofloxacin and some for quinolone resistant cases like Campylobacter, the alternatives are azithromycin and rifaximin. Then dengue. Dengue is caused by flavivirus. It is transmitted by Aedes aegypti. This inhabits urban and peri-urban areas. It is a day biting and there is no vaccine for dengue yet. So this is the dengue cases in Pakistan picture. So it is common in a lot of regions and especially after floods and rains. So the incubation period is 4 to 8 days. In dengue, the symptoms include fever, headache, retroorbital pain, myalgia, arthralgia, and due to loss of thrombocytes, loss of platelets, it may result in loss of fluid, which may result in dengue hemorrhagic fever. And if there is severe plasma leakage, it may lead to circulatory collapse, which is called a dengue shock syndrome. So the treatment is mainly supportive, and it should include prevention of mosquito bite by adopting a number of methods, which include throwing out items that hold water, tightly cover bottle storage containers, using insecticides, and using larvicides. Then malaria is transmitted by female Anopheles mosquito. The vector is night biting and common in rural areas. The most common protozoal Plasmodium species, Plasmodium falciparum, and it causes cerebral malaria, which results in a high number of fatalities. So greater than 40% of population is at risk, and it results in over 1 million deaths, most of which are in Africa. Incubation period is often 1 to 4 weeks. The person experiences rigors, fevers to 40 degrees, and sweating, followed by extreme fatigue and sleep. The treatment includes chloroquine, and the places in which chloroquine is resistant, then Malarone, Mefloquine, doxycycline, and Primoquine are recommended. They all are very effective if taken correctly. This is the picture which shows that the anti-malarial chloroquine resistance is developed in a number of world regions. Then rotavirus. It is the most common cause of diarrheal disease among infants and young children, transmitted by fecal oral route. It infects the cells that line the small intestine. Dehydration is common and vaccination prevents the disease. ORS therapy is recommended for infected children. Then schistosomiasis. It is required by insects in contact with infected fresh water with parasitic platforms, which are called schistosomes, the leaves for infected freshwater cells. It is common in tropics and areas of poor sanitation. It can be prevented by improving access to clean water. The treatment is praziquantel. This is of two types, schistosomiasis mansoni, which causes intestinal schistosomiasis, and schistosomiasis hematobium, which causes urogenital. So this is the picture in which you can see that the children have GI manifestation, which is caused by schistosomiasis mansoni. Then there is African tick bite fever, which is caused by ticks when the bacteria responsible is Rickettsia africa. It is common in South Africa. The symptoms include muscle pain, fever, headache, rash. The prevention includes avoiding tick bites by covering the skin using the repellents which contain this chemical and using permethrin. The treatment is of antibiotic treatment of choice is doxycycline. Then scariasis caused by it is caused by ingesting worm eggs. The symptoms include abdominal pain. This is an helminthic infection, worms. So the symptoms include abdominal pain, and the infection can block the intestine and slow growth. The treatment includes albendazole and mebendazole, which remove worms from body. It can be prevented by washing hands with soap and water before handling food. Effective sewage disposal system reduces community risk. Then overall, the measures which are recommended for prevention of disease include using insect repellent, using bed nets, full clothing, safe food and water, avoiding swimming if there is unclear status about the safety for prevention of schistosomiasis, safe behavior, avoiding high altitude because there is less oxygen as one progresses of the altitude, and then And one should have information about foreseeable health record or health hazards.